Well, hello, my name is Tom Lenz, and I'm a professor in the School of Medicine at Creighton University and the director of our Master of Science program in Integrative Health and Wellness. The purpose of this video is to give a little bit of an explanation about what Integrative Health and Wellness is and how we at Creighton approach this new and emerging field and how it fits in with health and wellness overall. So our program in Integrative Health and Wellness started in 2015, and it was based off of an already existing employee health program called the Cardiovascular and Diabetes Risk Reduction Program, which is now renamed to the Lifestyle Medicine Clinic at Creighton. And so when we started to look at what opportunities were for us to teach others in integrative care, we looked at a lot of options for names of that particular program, and it seemed like integrative was the proper name to use because what it means is that we're taking conventional medicine and adding to that other modalities that help an individual with their uniqueness and their unique needs relative to their health. We felt like it was important for us to add on health and wellness as opposed to other names that others are using there. And health, because in the broadest sense of the term, we look at health as far as really you can stretch your arms out at pretty much everything that is included in an individual's life affects their health. And so we wanted that type of context, but also connecting it with our conventional healthcare system and ways that we care for individuals. We felt like it was also important to include wellness because it broadens that perspective of what health means to include other aspects that are certainly unique and individualistic to folks and how they meet their needs relative to their own health. Integrative is a relatively new integrative care, if we want to use that as language, is a relatively new field within the healthcare system and within health in general. It's really only a couple of decades old for people who are offering programs such as this within the healthcare system or educationally or within the wellness fields. And so many languages, many names are used to almost describe the same thing, but essentially what integrative care means is that you combine conventional medicine, which would be things like taking medications, surgeries, anything that would be traditional or conventional within the healthcare system, and adding to that by way of a general term, meaning complementary medicine. And those can mean lots of things: nutrition, exercise, stress management, yoga, acupuncture, and so forth. So there are many modalities, many ways that we can use complementary medicine. And our approach at Creighton from that perspective is to focus on it from a lifestyle medicine perspective, which essentially uses nutrition, exercise, sleep, substance mitigation, such as alcohol, drugs, behavior modification, a focus on relationships, and combines those together with the conventional treatment plan for an individual who has a chronic condition to make a more holistic treatment plan. It doesn't really stop there either, because we also add to that a heavy emphasis on spirituality, on relationships, on the social factors that determine an individual's health, which can be their built environment or the structure where they live, that includes income and safety and so many other factors. So that's another layer of the integrative health and wellness program at Creighton University. So we have an underpinning for our program, at least I should say, maybe a better way to say it would be guiding principles that help us to move forward in how we teach our courses, how we treat our patients and clients, and certainly how we work with our students and other community members as well. And those guiding principles, one is in relational care. So we see our health as something that is very dependent upon our relationships with others, and that there's a relational, and we recognize that there's a relational exchange that occurs when we work with other people, and on a professional setting, but also on a personal setting as well. So that relational care involves the giving of compassion, empathy, and ourselves to another individual, but then also receiving something back from the individual that we are working with as well. And so we see this relational care as an exchange that flows backwards and forwards with the folks that we work with, not only in our professional lives, but in our personal lives as well. So relational care moves beyond the traditional transactional care that largely happens or has happened in our healthcare system, where it's a patient generally experiences a series of transactions when they move through the system to help alleviate pain, suffering, ailments that they have, to move into a relational perspective there. And so we can do the conventional medicine component where we're managing a chronic disease from that perspective, but that we feel like the individual is being cared for at a more individual, at a higher level, at a more personal level if we add this relational component to it. So that's very important for us, and it's one of our guiding principles. The other piece of a guiding principle that we have is a focus on all of the factors that may determine the health of an individual. And so we recognize that some of those include personal internal factors that an individual may have, but that doesn't just stop there, where we would say, for instance, that if someone for instance, needed to or wanted to lose weight, that it was just their responsibility to try to figure that out, and it was their own internal drive and motivation. Okay, so that's part of the situation, but it certainly doesn't make up the entire piece of an experience like that. And you could take any health-related condition and say the same thing. So there are many other factors that determine whether an individual, for example, can lose weight or manage blood pressure or adhere to some other regimen to help their health improve, that perhaps they have some control or maybe even no control over, and those are largely socially related. So the other foundational principle is looking at the social determinants of health and how that impacts an individual and their experiences. And when we can recognize those factors that are socially related, they may be economic, they may be relational, they may be structural in that maybe their access to food or to physical activity or a job that's going to be fulfilling, that those factors have an important effect on health. And so we use both relational care and the social determinants of health as something that helps guide the way we develop our courses and the way we offer our courses and the individual lectures and material that we provide for our students. And at the same time, they help guide how we care for the patients that we care for, the clients that we work with, and the community members that we work with in helping to develop programming for them as well. So Integrative Health and Wellness at Creighton is what we would say falls under the bucket of a whole person health program, where we're not just concerned about the individual's biometrics, such as how much they weigh or what their blood pressure is, or what the other lab values, but we're looking at them as a person in the greatest context of wholeness that describes the experiences of that individual has. And so when we can look at it from that perspective, then we feel like we're not just trying to alleviate pain and suffering from a chronic illness, but that we're helping the individual thrive within the personal and professional and relationships and environments that they operate in. So that's Integrative Health and Wellness at Creighton. I would love to discuss this further. If you have questions, feel free to reach out and let me know. If you're interested in the program, I'd love to talk further about that, and maybe we can work through something together that fits your personal and professional goals.